ABC 10's Lena Howland is live at the Capitol. So, Lena, I guess we all want to know what our lawmakers saying about the backups.
Well, Brittany, we just heard from EMS workers from across the state speaking out to lawmakers about what they're calling extremely long wall times, which means getting a bed for their patients once they arrive at a hospital in an ambulance can sometimes take several hours. Some are saying this could be the most significant medical crisis in California state history. So what we just heard inside of that meeting, you see video of it there. Many state lawmakers, they are in the middle of that oversight hearing inside the Capitol to talk about possible solutions on how they can move forward. While this issue has been exacerbated during staffing shortages and a huge demand amid another COVID surge, many EMS workers say this problem has been decades in the making. Some of the proposed solutions we heard from those speaking out today were to develop new regulations, as current EMS regulations were established more than 40 years ago, to fine hospitals anytime they hold an ambulance for longer than 20 minutes, to ask hospitals to hire their own EMTs to care for patients once they're dropped off, and to ask hospitals to pay EMS services for their wait times anytime they are held over.
The greatest thing we're doing right now is bringing the awareness. In order for us to affect change, we need our lawmakers to know exactly what's going on. We need our community to know we're fighting for them. And we need the hospitals to get on board and start adapting to what's going on.
Let me be clear, extensive wall times are not good for the patient. They are not good for the ambulance crews, the firefighters, the medics. Wall times are certainly not good for someone making an urgent call to 911 for medical assistance when there isn't an ambulance available to dispatch.
This is something the chair and vice chair of the committee both understood, as they have each served more than 3 decades as emergency medical service workers before becoming lawmakers. Now, happening right now, lawmakers are still inside of the Capitol right now, hearing from a second panel. This time they're hearing from the other side, from hospital officials, on what solutions they have to offer. Now, either way, one thing was very clear today. EMS workers say they need new legislation in order to make a positive change. We will continue to follow this each step of the way and let you know what happens. Back to you.
It is a big story. We have to support our first responders. Thank you so much, Lena.